Thank you for joining us today. I'm Noah Pismoni-Levy-Dresner, a member of the class of 2000 and a member of the Alumni Board, a group of 25 members representing each of the university's schools with the purpose of engaging all alumni and students in lifelong connections with one another and within the university. In my regular role, I'm a professor of higher and post-secondary education at Teachers College, Columbia University. I'm also co-chair of the Diversity Advisory Council, which provides leadership guidance and feedback to the University of Rochester on diversity and inclusion initiatives for its alumni and students. Today's lecture is part of a series called Experience Rochester that exemplifies the university's commitment to lifelong learning. We have a wide range of registrants joining us for this session, from current parents, students, and alumni as far back as the class of 1955. Welcome to all of you. Before today's webinar begins, I'd like to share a few Zoom webinar tips for those who are new to this platform. If you would like to ask a question, please submit it through the Q&A function that is located at the bottom of the screen. The panelists will answer the questions at the end of the presentation. If you would like to view this session with closed captioning, click on the CC on the bottom toolbar and select Turn on Subtitles. If you have any trouble viewing the webinar, you can call in and listen using the phone number that was included in your confirmation email. Today's socially distanced virtual lecture that many of us are attending from home as we continue to shelter in place is focused on the nexus of two pandemics. The first, the global pandemic of COVID-19 that is merely a few months old, and the second, a US-grown pandemic of anti-Blackness, systematic and institutional racism, and white supremacy that has plagued our nation for over 400 years, since 1619, over a century and a half before the signing of the Declaration of Independence. These two public health crises have created a perfect storm, or should I say an imperfect storm. This imperfect storm is part of our imperfect nation that has brought us together today. We are joined by a panel of health, education, and community leaders that will discuss some of today's most pressing social issues, including systematic racism as a public health crisis and the effects of COVID-19 on the health of communities of color, and provide steps we can each take to build a better future for us all. Our shared motto at the University of Meliora. Mercedes Ramirez Fernandez, the Richard Feldman Vice President for Equity and Inclusion, and our university's Chief Development Officer will moderate the session and introduce our panelists. I'm privileged to ask her to join us now and turn it over to Mercedes.
Thank you so much, Noah, and hello and everyone, and welcome. As Noah indicated, I am Mercedes Ramirez Fernandez, and I am the Vice President for Equity and Inclusion at the University of Rochester and Chief Diversity Officer, and it is such a pleasure to be here with all of you today. As many of you know, the topics that we will be discussing today, namely education, healthcare, and social policy, are all important topics and issues of their own. Too often, Black and Brown communities, face challenges to all three. Unfortunately, the COVID-19 pandemic has only exacerbated the damaging effects of racism, marginalization, and inadequate access. Today, we will be discussing the individual topics of education, healthcare, and social policy, but we will also consider how these issues overlap, intersect, and connect. It's in those intersections and connections that we will find the lived experiences of people of color and the harsh realities of racism and oppression. I am delighted, to have with me today three extraordinary panelists who will speak to their scholarship, practice, and expertise. Kara Finnegan is Professor of Educational Leadership and the Director of Educational Policy Programs at the Warner School of Education and Human Development. Kara blends perspectives in education, sociology, and political science. Kara, thank you so much for being here with us today. Paula Cupertino is a professor and social behavioral scientist at the University of Rochester Medical Center. Paula focuses her research on health disparities and underserved and marginalized communities. Paula, thank you for joining us. Wade Northwood is the CEO of Common Grounds Health and a Rochester alumnus. He is a longtime community advocate and has spent 3 decades in leadership positions throughout the city of Rochester. Wade, it's a pleasure to have you with us today. So I'm going to turn to Kara. I would like to start with you, Kara. And could you please tell us about your work and some of the changes you've seen since the COVID-19 pandemic?
Hi, thank you so much. I'm really happy to be here today. I'm Kara Finnegan. I'm a professor of education policy, as was mentioned. I've been at the university for 17 years, and my whole career I've focused on educational equity and systemic racism and policy design and implementation. And I would love to talk to you all about those things for a much longer time, but since I have such a short time today, I did want to mention that a lot of what I'll be talking about is in my book with Jennifer Jellison-Holm from UT Austin. She's at UT Austin, and it's called Striving in Common. You can see the picture here, where we talk in much more detail about how we got to this point in education and what to do about it. So if you could go to the next slide, I will start by talking about what is the problem in education. So we talk a lot about the school failure, district failure, particularly in urban school systems. And mostly in the North and Midwest, we hear these conversations. This is just a word cloud from Minneapolis, but you could see this all over the country where people are thinking about achievement gaps and college attendance rates and things like that. These regions especially are important because they have many districts in one metro area, which causes a term we call geopolitical fragmentation, which means that in one geographic place, we have many districts that end up sort of competing for resources. So let me focus in on Rochester to explain this a little bit better. In Rochester, but we saw this across the country in our book, there's low proficiency on state tests. That's a fact. And so many people make the case or call for solutions as far as why this is so. Much of the blame focuses on people within the urban school system. So in Rochester itself, whether it's parents or teachers or students. And a lot of people talk about a lack of standards and accountability as sort of driving why performance is low. So over the last decades in education, we've had testing policies, policies around governance changes to the schedule, whether it's the school day or the school year, retraining teachers, things like that. And it's not that those are not important to attend to, but we call these kinds of technical changes sort of more isolated components of what is a much bigger problem in education and in our country. So if you could go to the next slide, I'll make this a little clearer. What we focus on is really the tip of the iceberg. And what happens is we sort of tinker around the edges, and we frequently exacerbate the problems that exist through these policies. So we've seen that in the last decades through accountability policies in particular. And it targets one piece or a few different pieces without really focusing on the systems that drive the inequality to begin with. So if you could go to the next slide. So why this matters is that 1 in 2 students are actually homeless in the city school district. This number is equivalent to the total number of students in the surrounding 3 districts. So it's not a small number of homeless students. There's high rates of English language learners in the city. There's high rates of poverty. In fact, in Rochester itself, we have more than 50% of children living in poverty in the city of Rochester. That's one of the highest across the country. And this fragmentation and segregation that we see is actually the result of prior policies and decisions. So you might be aware of this already, but I'll just run through a few of them. You know, the federal government, with the help of the real estate industry and banks, subsidized white movement to the suburbs through low-cost loans. Loans were denied to people of color. They were excluded from certain communities in the suburbs. And then state law also allowed suburban communities to incorporate into separate municipalities. So over decades, we've had policies and policy decisions and practices that have sort of cordoned off some of the challenges that we face in terms of the impact of racism and creating a concentration of challenges within what also happens to be the school district boundaries of the city. So this map, I just want to talk a little bit about to help you really understand what this says. It's not just a visual to help me in the background. This is actually actual data from Rochester, the Rochester region. And while you might not be able to see all the different communities very clearly, if you're someone who would remember all the communities, what's important is that the city of Rochester is in the center. And this is a map of all of the children under 18 who live in poverty. And of course, there's some poverty pockets in rural areas. That's not that uncommon. But if you see the darkest parts of the slide are in the city center. And in fact, some of those darkest areas, more than 75% of children live in poverty. So that is really important to understanding the context. And also, if you go to the next slide, this is the flip side of it. So if you think about median income as helping us to understand the resources that are in a particular community, in the city center, the median income is 15 to 20,000. And again, you can see the stark contrast as you go from that city center to the suburban and more rural areas, where the darker areas are 100,000 plus in terms of median income. And why this matters, again, is that it's part of how our district boundaries align with these inequities. So one of the things that a colleague of mine, Sean Reardon at Stanford, did a study with his colleagues, and he found that he studied every single district across the country and found that racial socioeconomic disparities and segregation patterns are consistently the strongest predictors of racial achievement gaps. So we really can't talk about urban school district failure without understanding these broader issues in our community. So if you could go to the next slide, I'm going to talk more about some of the ways that we address these things in a moment, but really quickly I'll just mention that as I want to put in the back of your head why regional solutions are important. They allow, well, first we need multiple policy strategies in general that are in combination, not sort of these separate things targeting different components of the problem. We also need to attack the systems of competition that fragmentation that I mentioned at the beginning causes. We also need to reduce the barriers resulting from those school district boundaries themselves, or the students who, as Patrick Sharkey in his book refers to, are stuck in place. And finally, thinking about things regionally allows us to attend to these inequities in a regional way through governance and resources that we would have to really put that into place to do. So I'm going to stop there, and I'm going to shift to Paula Cupertino, who's going to take you through the next step.
Hi, everyone. This is Paula Cupertino. Thank you, Kara, for the introduction. And today I'm going to share with you some the work that we have been doing at Wilmot Cancer Institute and what happened to our work when we had COVID and George Floyd death happening. And looking forward to talking with you after. Thank you for the invitation. Next slide. So here at Wilmot, we have a catchment area that covers 27 counties in the region, in which we're growing our presence in terms of community outreach, engagement, and disparities. Next slide. We know that in our catchment area, we have been doing worse in terms of cancer incidence over time. But what is alarming is there is a growth in these geographic disparities in comparison to New York State and United States. We must work. Next slide. And when we look for different specific cancers, we see the racial and ethnic disparities illustrated here by liver in the Hispanic population and lung cancer and pancreas in the Black community. Next slide. This is not new, right? And we can go in depth looking at the correlation between smoking, behavioral, and lung cancer mortality. And we can start using all these new tools and machine learning and geographic informal system to identify the pocket areas, the hotspot areas where we need to put our attention in such a way that we have an impact at that population data showing that there is this disparities happening geographically comparison to the New York and the state. Next slide. So work was going well, and we were doing all this data, doing all this reporting when COVID come into place. As we start seeing the data showing that African Americans and Latinos were doing worse in terms of the clinical outcomes, we decided to go and talk to the community and learn what's going on that we could explain. Right? We know all this data that we report over time in which there is a disparity, but let's listen from the community. And we heard things that we already know. Facing COVID, the Black community and Latinos rely on their faith in God. They all know that the best thing that they can do is organize and help each other as we're facing COVID. And we also see that, you know, that hopeless feeling that no matter what I do, it is what it is, and I just need to wait, hang tight, and wait for things to get better. We also want to know the compliance with guidelines, you know, so basically the use of mask and washing hands was more present in the Black and the Hispanic communities. But when we look at disinfecting groceries and, you know, changing clothes and doing additional, following on additional guidelines, we're falling very short. Next slide. So, and as we all know, 100% declare insufficient income in this as they are facing COVID. So what can we do at this point? I think one of the areas, you know, as we are working in cancer disparities, we can start looking at all this new counterintuitive data that can disproportionately benefit the Hispanic and Black community. For example, there is a new data showing in China that by treating smokers with nicotine replacement therapy, a very affordable drug, has had a positive impact on in COVID, in treatment of smokers. And guess what? We know that in the Black African American community, the rates of smoking is very high. So yeah, we could dive in a target, tailor, community-based, community-driven trial to do this work in Rochester and probably have a disproportional positive impact in this community. However, we know that the trust in clinical trial is not there. You know, we keep listening that clinical trials don't have a representation from the Black and African community. And the reason is they are not going to participate unless we bridge the gaps. So it's one approach that we can do in this context. Look for community-based, community-driven trials and studies that can overcome this disproportional worst outcomes that we see in the Latino and Black community. Next. But what I truly believe, and I think can bring us the answers, is to invest in this pipeline of underserved minority students. And here the example of the work that Brooke Jones have done with me during the summer. In 8 weeks, she put an outstanding, aggressive, innovative study looking at COVID beliefs in practice during protest, as she was a leader of organizing protests in the state of Missouri. This is the future. This is for me, taking care of the roots and growing this diversity in the pipeline as the answer that we need in this moment more than ever before. Let's look at the data and the work that Brooke, I wish she was here presenting in my place because she could do much more justice considering the passion and investment that she put in this project. But here I am trying to share her work. Next slide. So she did a very good job in putting this timeline that came all the way from the COVID outbreaks to Floyd's death and the protests that she followed over time. And she looked carefully, as we know, protest attendance as well as hours protesting has a significant impact on the exposure and the positive COVID status. So she did that work because there is a myth out there that, special communities participating in protests, they don't care about COVID, social distance, and the guidelines. Let's see what she finds. Next slide. So she has a lot of quantitative data. She's going to be working with us to publish. But I think for now, I just want to call attention to the quotes. Protesters are concerned. I think most of them got tested for COVID. And overall, there was a feeling that the interaction of the police and the enforcement done during the protest significantly disturb and impair the intent of following the guidelines during the protest. And absolutely, they all agree that their voice needs to be heard, and they're willing to remove their mask or get closer to each other to make their voice present. Next slide. In the additional comments, they overall in her sample, the quotes, the qualitative study showed what we know. The enforcement from the government and the police significantly disturbed how the Black community addressed the pandemic, and at the same time made their voice heard in this momentum that get all of us here to think carefully. What are we going to do? What are we going to do in our jobs, such as on mine, to address the cancer disparities in our region? Next slide. And I'm eager to continue to discuss with you. And now I have the honor to introduce a leader that I have enjoyed so much to hear, and now hear from him, who is the CEO of Ground Health in the region. With that, I give the word to Wade Northwood.
Thank you so much, Paula. And I would say hello to all and just share how delighted I am to be here, joining you virtually, and to see so many dear friends on the call. I would frame my remarks by saying that I am very mindful of the comments that Frederick Douglass made in response to the Plessy versus Ferguson decision in 1896. And I would say to you, my job is to be here to share in sharing with you the ugly facts. And the facts are ugly. Next slide. Douglass said in that speech, strange things have happened of late and are still happening. And I can't think of any better way to describe what has been our experience in the course of 2020 than to refer to the strange things that have been happening. But I will say to you, as the head of the region's health research entity, that quite honestly, the fact that COVID has a disproportionate impact on people of color is not strange. In fact, it is exactly what we should expect when we understand it's a highly transmissible disease that preys on folks who have such chronic conditions as diabetes, obesity, and hypertension, which we know disproportionately impacts the communities of color. When we think about the fact that this transmissible disease makes those folks who are in frontline high contact service positions incredibly exposed for risk of catching the disease, and that very much explains our low socioeconomic status workers, low SES, and our workers of color. And when we think about housing construction, for those who live in homes like mine built in 1916 that really are not suitable for isolating people with a bedroom and a bathroom from the rest of the occupants, there's no surprise that we would wind up seeing what we are experiencing, not only in this community, but in the nation. And I really want to thank Kara and Paula for doing one incredible job of proving what Don Berwick called the first law of health improvement, which is recognizing that every system is designed to achieve exactly the results that it achieves. Next slide, please. That we should not be surprised that we are seeing the health inequities that we're seeing because they reflect the social inequities. This is one of my favorite maps. It's a great cartoon. A picture's worth 1,000 words. So by showing you this picture, I'll spare you 1,000 words of me and try and be done in the next 3.5 minutes. This is a map of the Finger Lakes region by socioeconomic status, by zip code. And as I hope you see very clearly, poverty is not relegated to the city of Rochester, which is the cross-shaped color in the upper left-hand corner. But quite honestly, poverty characterizes the entirety of the Finger Lakes region. And if you'll forward, Amy, what we will see is that if you impose the same map by zip code, but color code this time in terms of premature mortality, what is very clear is that poverty is killing us as a region. And it is absolutely imperative that we do something about it. Next slide, please. We've moved our data at Common Ground Health from conversations about what's going on to why do we see what we're going on. And I just want to rapidly run through a couple of slides with you. The first major finding that we see from our regional health survey, where we talked to almost 7,000 folks who live in the Finger Lakes, is it has really highlighted the role of mental health in our region. Next slide. And I would say to you, as we look at people's self-reports of mental and emotional health, you can animate one step for me, Amy. What we begin to see is that what looks like a wonderful picture at the regional view, when we start drilling down and we look at those who are in low-income households, next slide, Amy, we begin to see the picture looks differently when we think about folks who are in households that earn less than $25,000 a year. It looks even more different for those households, next slide please, who are low income, but whether they're urban, rural, or suburban, tell us their neighborhood isn't safe. And it becomes even more different, one more slide please, if we look at those who tell us they also face barriers to transportation. And there's an African proverb that says that the wise village is a village in which the elders awaken in the morning and they go to bed at night asking of themselves, how are the children? These are reports from the adults. We need to be very focused on, if this is what's going on with the adults in our region, how are the children? And it's why I am incredibly proud that folks like Kara and her colleagues in Warner have adopted and taken on the opportunity of East High School, that our Department of Pediatrics is on the leading and cutting edge of thinking about how health and mental health and whole child health come together, and how the University Center for Community Health, next slide, is really moving us beyond just simply thinking about the problems to implementing solutions. And I want you to know, Douglas said that despite the ugly facts, his hopes had never been brighter than before. And my hopes are bright because of the fact that you need to know, as I know as an alumnus, that this institution is actually involved on the street level, making a difference. Over the last decade, we have changed high blood pressure control rates in this region. We've improved them by more than 40% because the university has committed to moving beyond pounds of cure to investing in ounces of prevention. And I think that is the job that stands before us as the opportunity for the 21st century. A crisis is a terrible thing to waste. And my prayer is that we will not waste this crisis, but we will use it to build a next normal that is better and more beautiful than the one that was given to us. So my friends, I will spare you listening further to me, and I will invite my illustrious colleagues to come back and join me, and I will hand the talking stick back over, and we will have opportunity for a bit of conversation and discussion before our time ends.
Thank you so much, Wade, and thank you to all of our panelists and to Noah for getting us started on this wonderful lecture today. There's many questions, on the queue here, but I'm going to select this one for Kara. Kara, you spoke about disparities within communities and showed extreme segregation in our community through your maps. What does your research suggest is necessary to address those inequities in Rochester and other communities across the country?
Well, thanks. At the risk of being able to get too far in the weeds on policy, I'll try to just summarize in a couple of minutes or less. So in our framework, we argue from our research that you need to tackle these issues of segregation, fragmentation, and competition at the core of the policy change. This will require both some local and state policy change. Sometimes people think a regional response only means consolidation of districts. There's actually a number of strategies that are regional in nature. That it's not to say that consolidation couldn't be a worthy thing to consider in a particular community, but our framework builds off of the work of John Powell at Berkeley, who talks about federated regionalism. So it actually keeps some of the structures in place, but allows a different way of thinking across them at the whole region level. And just quickly, it involves some tax redistribution, some place-based investments in the city, mobility policies for students to move across some of the boundaries, which we already have in Rochester and many places, and then a regional governance structure, which we also often have in communities, but that could focus on these kinds of issues and decisions using an equity framework. Just two other quick things. The school funding formula in New York State, one of the things that we have to focus on at the state level is thinking about some of the ways that also has caused some of the inequities that exist. So there have been calls to changes to funding formulas. And last, just in case people are concerned about changes like this and the impact they would have, there's a great deal of research on integrated classrooms and integrated schools that shows a positive impact for all students. Of course, there's also some research that shows that we have to have certain things in place to make sure that all students benefit. But I want to make sure that some of the instant kinds of concerns that are raised, like we actually could come together in a community and tackle those things. And we have ways to do so that we know from research.
Thank you so much. Thank you, Kara. The next question is for you, Paula. So your work shows the direct connections between health disparities and communities of color. Could you please talk a little bit about how we can address limited access, to quality cares, and what steps we can take to alleviate and ameliorate those problems?
Well, we could be hours here, right? Talking about the barriers and perceptions and beliefs and why access continues to be an issue, to the point that we see that the communities of colors are coming into the hospital to address COVID at a much higher rate than any others. And we know comorbidities out there, lack of access, lack of management of hypertension, diabetes, and you name it. But I think what is missing, and very few groups are doing, go to the community to ask this question. We could, and there's tons of data But what I'm trying to provoke here, you know, I know this data is great, is intriguing, and but let's leave there. The momentum now is for action, and we can do this. Us here, you know, we need to go to the community. This is the goal, to do a deep dive, especially in the Black community, to understand what is going on. They're not coming to us, you know, and we can speculate for the reasons, but I'm very interested to do this. 3 months in Rochester, but I think this is the next step. We need to go out there because each region has specific reasons why. We need to talk to the leaders, the gatekeepers, and the real people out there. So this is my little contribution today. Sorry, I don't have the bullet, you know, the magic bullet at this point, but eager to go out there with you and all of you.
Yeah, definitely. It's going to take all of us. Yeah. Thank you so much, Paula. This question is for you, Wade. So you spoke about the intergenerational transfer of systemic racism and marginalization. And, you know, could you expand a little bit on that? I know that we have given you such a short amount of time, you know, for to share your wisdom, but, you know, we would love to hear more.
I think that the entire area of epigenetics, of really understanding how the in utero experience informs, shapes, and bends life course trajectory, is one of the most amazing areas of research and application for the university and its academic community. I really encourage those who are listening in, who are not paying attention to how the university is a leader in this space, of how the university is engaged in perinatal health. And really, I think the opportunity of East High School is to really get deeper into preconception health with young ladies and young gentlemen before babies are even born, to assure underlying health. My mom made it very clear that the whole issue in life is to understand that generational curse within the families and figure out how to end them. And I think, as Paula was just saying, the opportunity is for us to take those modes of cultural transmission and those mores that exist in the laundromats and in the church basements and bring them into partnership with the scholars and the care practitioners at a kick-butt academic medical center like the University of Rochester. Meliora is who and what we are. This is about ever better. And I think we really need to understand those experiences that mom has while she's carrying a baby, being evicted, having the heat and lights turned off, which didn't happen in the Rochester in which I grew up. We would never turn off the electricity and heat in the winter. We do that now. Why do we do that now? And how, as we really brought the scholarship of the university to bear and passed the nation's leading signal lead poisoning prevention act, and we've reduced lead poisoning by 85% in this community. How do we move to tackle new problems? How do we embrace new horizons? And how, as Paula just said, do we recognize that some of the best scholars are the grandmothers in the barrio? And how do we bring them in to help us surface new understanding and find new pathways to learn, heal, create, and discover?
Well, I had one of those grandmothers in the barrio, so I really appreciate that comment, you know, Wade. And there's been a lot of concern around, you know, educational equity during the pandemic. And so I would like to ask, Kara, how can you tell me a little bit more and tell all of us a little bit more about how educational equity is being impacted by the coronavirus?
Sure. So all of these patterns that I was mentioning that have happened over time in terms of segregation and poverty and educational inequity are really being exacerbated right now, and I think will be moving into the school year. I mean, the economic downturn will hit urban school districts the most because they have a greater proportion of their resources coming from the state because of the way our funding formula works. It's a longer conversation, of course. And even the things like increased health and safety protocols, many districts don't have adequate numbers of nurses or social workers, and these are things that are with the health and safety protocols that we need to put in place for the pandemic. Those will take resources. Challenges around online instruction for students living in poverty in particular. We haven't had a lot of discussions about, having a space to learn, having internet connectivity, things like that. And then some of the ways that in our book, we talk a lot about how localism is sort of it's a natural part of what we do. We sort of are providing supports to our own families and our own smaller communities. But what that means is as people are trying to grapple in their own communities with what to do with schooling in the fall, is they're starting to think about things like pods you might hear about, where certain groups will join together. And if that happens in terms of either the resources they can pay for their teachers for their own children, or just the groups that will naturally be formed in these inequities across districts and communities, it could again further exacerbate these things that we're seeing. So we want to make sure that we're paying attention to all of these things in terms of how the pandemic is impacting them. And one last area, the racial violence, the police violence that we see in communities is also a common difference in terms of how students are disciplined in different districts. And so that you can see some patterns around having to address those in an anti-racist way moving forward too. So there's a lot of things to think about that are just sort of, more, I guess, urgent right now, given the pandemic.
Okay. There's another question that is for you also, Kara. So given the history of Blacks being segregated into urban environments by policies and practices, lending and redlining, as you mentioned in your remarks, and real estate sale restrictions, how can we build policies into schools to build opportunities for meaningful employment into high school students to help students have jobs immediately upon graduation?
That's a great question. So one of the things that we also talk about in the book is that we need much more attention to thinking about education policy along with housing policies, along with health policies, along with workforce development or criminal justice systems. And so if we think about just that one example as a good example of how we know there are needs in our Rochester community in terms of the workforce, in every community, you could sit down and figure this out and then try to backtrack into the kinds of opportunities students have. So we've done that some in this community and I'm sure across the country, but really thinking more strategically about that would be beneficial. But you'd have to have, we work in silos. And so you'd have to have people really coming together across sectors. And that's just something that, we are doing some in this community. I want to mention that as Wade was mentioning, the University of Rochester, I think is really ahead of things in some ways. And we just launched the new Community Engagement for Racial Justice Committee that Wade and Paula are both on, and that reports to Mercedes' office. And that's really a different way of thinking about our work with the community as a university. We do have East High, we have plenty of other things going on, but really to think about how our role in the community, in community change across these various sectors can really impact these challenges we're talking about. And so I think we're at a place where we know what needs to be done and we have community members and University of Rochester staff and faculty working on it. So I think that's really promising.
Thank you. Thank you so much, Kara. Trying to make a decision here of which question to ask, and also looking at the clock, but for you, Wade, you discussed, basically you're busting the myth of meritocracy. So what does busting that myth means for social justice?
I think of growing up and the games that we played in the neighborhood, all the kids coming together, and how it was the obligation of the older kids to make sure that the younger kids had head starts in foot races, had an extra out in baseball, that we really understood that it was important to create a fair playing field for everyone. And a fair playing field didn't mean an equal playing field. It meant achieving equity by providing the supports needed so that everyone could fairly compete. And I think as much as we love to hold to the construct of the meritocracy, everybody is rising based on their own effort. I think it really, going back to the incredibly powerful presentation Kara gave, it goes back to understanding why it is that as an armchair genealogist, I can't find Social Security records for anyone older than my grandmother. It's because they weren't allowed to enter into the Social Security program because the law specifically ruled out agricultural and domestic workers, which were by and large Black America. If we really understand that none of us have achieved where we are without the force of a tailwind or a headwind, it makes it easier for us to understand that what we have to do is we have to change the water in which we all swim so that we all are able to swim to the best of our ability. And what I find, which is the most amazing thing about being alive in the year 2020, it is why my hopes have never been brighter than before, is that if we really sit and have conversation with each other, it's not hard for us to recognize that there's a need for a fairer and more just world. What I lament is the fact that we don't often have the time for the conversation. And so on behalf of the 290 folks who are participants and those of us who are panelists, or if I'm the only idiot who feels this way, I want to say thank you, Mercedes, to you and Noah and Adrian and all those involved creating this conversation. Because the only way we're going to find common ground, pun intended, is if we take the time with facts to sit and engage one with another.
Thank you so much, Wade. I appreciate, your comments, and, it's very inspiring. There's a lot of work to do. I want to thank all of our panelists, for the work that they do on a constant basis, on behalf of our communities, and for spending the time with us and for sharing time with us today. I am going to ask Noah to come back and wrap up for us, with closing remarks.
Thank you all so very much. Thank you, Mercedes, and all of you for a wonderful conversation that was simultaneously inspiring and frustrating that we are still having these conversations over and over again, and the need to figure out how to actually make change and make systematic change. And I want to thank all of you for joining us today. We hope you enjoyed the program, and we would love to hear your feedback. Please take a moment to share your thoughts with us about the session through a brief anonymous survey. The link for the survey will appear on your screen at the end of the webinar, and you just have to hit select to get to the survey. It will be wonderful to hear your feedback so that we can continue to provide these webinars in the future. Speaking about future webinars, please also join us in 2 weeks on Thursday, April. Pandemic has thrown my timeline just a little bit off. Thursday, August 13th at noon Eastern time for Experience Rochester's lecture, Suffrage Stories in the University of Rochester's Special Collections, featuring Autumn Hegg, Assistant Director of the Department of Rare Book Special Collections and Preservation. Again, that's August 13th, not April 13th. So thank you all for joining us today, and have a great day and stay well.